Thank you very much for inviting me to present at this symposium. I very much enjoyed the photonics and pandemics sessions, and indeed, unfortunately, the virus is such that much of the tools that we are working on apply or are impacted by it. Certainly, this is a change of gear for the session. Nonetheless, a toilet, one of the least, one of the most unexpected places is actually a tool for digital health and improved diagnostics. So I'm Sonia Grego. I am part of the electrical and computer engineering. I'm presenting a work that is a result of the collaborations of ECE experts of wastewater and sensors with machine learners and Duke Medical School gastroenterology experts. So what is digital health and what does smart toilet have to do with it? So digital health technologies use connectivity, sensors, and analytics to monitor individual health, and everybody may be familiar with wearables, Fitbits, smartwatches, and the like. These are all great, and the pandemic has particularly strengthened the interest and the focus on telemedicine and tracking your health at home, as opposed to going to the hospital. So this is one of the major trends of healthcare. A major gap in everything that is being tracked are metabolically relevant physiological specimen that is available daily without having to poke an individuals, and that's excreta. And a lot of health data is in specimens that are literally being flushed away. So enter our solution to address that and save the data. Now, one of the questions that I'm often asked is, but really, what kind of information is there? Well, one aspect, just the bowel movement frequency and appearance, consistency, color are important diagnostic inputs. If you've ever been to a doctor for a tummy ache, that's the first question that you get. The challenge is individuals have a very subjective description of it and poor recall, particularly for chronic conditions, of what happened, not the day before, but what the frequency and appearance is over time in the previous week, in the previous month. There are up for digital diaries, but this type of tracking by hand is really burdensome. Then there are actual biochemical assays that are conducted on stools that contain a wealth of information on infectious diseases. And yes, COVID is a COVID virus. While COVID is a respiratory disease, the virus is shed in feces and can be detected in wastewater for surveillance purposes, can also be detected in stool directly if one had easy access to it. And as well, there are also biomarkers for disease and cancers. The reality is, in medical care, stool is used very little, and gastroenterologists tell me, and it's also documented in the literature, people prefer to give a blood sample than to give a stool sample. So they prefer to be stabbed by a needle than having to handle their own feces. This aversion is global, is worldwide, and is a major limitation to accessing these data streams that is essentially provided at non-invasively and daily. So enter our invention. So we have developed a system which we call a smart toilet technology that serves as a flush and forget excreta sampling and diagnostic. So we envision it, as shown here, as a system that adapts to the existing toilet in the home. And the key point is that the toilet appears completely conventional. The user experience is unchanged. There is nothing that grabs or sensors, nothing appears in the bowl. It's going to the restroom is a very private act, and we know from our experience, since we have been reinventing the toilet for other programs for a while, we know in our deployment of new technologies that the technology has to be invisible to the user. People don't like want a white ceramic bowl with water and nothing else. So we've developed a system that can do that and can collect on-demand specimen and can track bowel movement frequency and appearance. And these are the area where I'll focus our work, because they do involve optical sensing modalities. So where optics and photonics is helpful is also within tracking of excreta in a smart toilet. We have demonstrated two optical imaging modalities, imaging and light scattering. Now for imaging, as you see, the key of the technology is that the images are acquired outside the purview of the user. Essentially, ours is a wastewater handling system. So there is no discomfort engendered in the user, yet there is an image. So an objective data collection. And the need then comes because we envision the system installed residentially and acquiring images over time is not one image. We need a machine learning algorithm that classifies the images as abnormal or to be tracked automatically. And so we entered the collaborations with the machine learning experts, and we've developed a convolutional neural network to classify stool form. Now, you may be shocked, but I'm joking. Of course, there is no available database of stool images to train the algorithm. Now, anybody that has worked with machine learning knows that for supervised learning, you need a large data set to train the algorithm. So where would we go and obtain these images? Even if we were to deploy one of our prototypes at one event per day, it will take years to collect this much data from a prototype. So we got creative, and plus it was COVID times, so we were also stuck at home. So we launched a crowdsourcing campaign that was actually remarkably successful. We asked people to send us their images from home. So we collected, and we also searched the internet. So in the end, we had over 3,500 unique stool images. And I don't know if this is harder, but yeah, it's pretty remarkable. I convinced two busy clinicians to sit down on a computer and annotate each of the images in terms of their characteristics. And this is the only gross image that you'll see in this presentation. This is the clinically accepted scale for stool consistency, which are these 7 classes, the Bristol stool form scale. Now, it's very common to use machine learning to teach an algorithm to recognize texture in an image, and this is essentially what we did. So we have 7 classes, a very heterogeneous samples, a lot of work done, and in the end, we are pretty pleased with these preliminary results. The algorithm compares well enough to the gastroenterologist as much as the two clinicians agree with themselves. The algorithm was also computationally efficient, so we have already installed it on a Raspberry Pi microcomputer for deployment near the prototype device. If instead of going through all those 7 classes, you're just interested in defining whether this stool is normal or on the constipated side or on the loose side, these are the major the most clinically relevant definition, we obtained an accuracy of 85% with our algorithm with the current data set, and we expect it to improve over time. So optical imaging and an algorithm are putting the artificial intelligence in your smart toilet, where the photonics helps in one last feature is how to distinguish watery stool from other liquid or simply urination that occur in a toilet. Imaging is not very effective. We think we can enhance this detection by using a different sensor, and turbidity was one of the many that we found was actually non-obvious to determine which sensor was the most discriminating. Simple light scattering, turbidity meters are a classic tool of water and wastewater quality. So we had one in our lab and we did some measurements. And when done in a beaker, the ability of the turbidity meter looked okay. It can certainly distinguish a turbid, loose stool sample from urine, but having a meter doesn't do us any good. We need something that is dynamic, that can catch the specimen while the toilet is flushed. So we don't need a meter, we need a dynamic sensor. Luckily for us, the white good industry has uses turbidity sensors. So your toilet cannot tell you if you're sick or cannot tell your loved ones if you're sick, but your dishwasher has a sensor that can tell if the water is turbid or not. So we tested one such dynamic turbidity sensors, which are truly affordable. And I should say here, the Adafruit company that a previous speaker mentioned is who we used to get the sensors. And we were pleasantly surprised. They are pretty linear, pretty robust. They have even better solid range content, even have a better range than the turbidity meter because they don't need to be super precise. And these are examples of data. On the left are controls, and on the right are signals of those stools that we flushed in the toilet that we have in a laboratory, and the signature of loose stool is clearly distinguishable by the other ones. So turbidity sensors is an effective tool for a dynamic response. Now, just to remind you, why would one need a sensors for a physiological act that you know very well if your stool is loose? But think about this. There are cognitively impaired individuals, for example, the elderly, who are disproportionately affected by gastrointestinal diseases, but may not be able to be aware or to communicate that they have either a constipation or a diarrhea. And interventions such as hydrations are currently implemented only if a nurse happens to catch their bowel movements. So I feel like we believe it is urgent and about time that toilets that capture valuable physiological information from excreta become a part of the toolbox of digital health. So this is the summary and of what I've presented, and this is contact information if you have questions. And I'm stopping here.